Hi, I'm Dan Lagani with Silver Solutions, and welcome to part 2 of a very special edition of AgeWise. In this series, we're covering hoarding, what it means especially in the lives of older adults. We sat down with our guest, Dr. Michael Tompkins, a clinical professor at UC Berkeley and a founding partner at the San Francisco Bay Area for Cognitive Therapy. In this episode, we cover critical topics like how to deal with the issues. So if you have somebody in your life that you're concerned about their safety and you're trying to determine whether it's simple accumulation or a deeper problem, this is absolutely a worthwhile episode. Talk to me about how you use cognitive behavioral therapy to start to address the underpinning of why somebody's collecting.
Well, people with hoarding disorder who come in for treatment of their hoarding disorder, cognitive behavioral therapy, are farther along on their trajectory than many of the individuals that you meet, right? And maybe family members of listeners of this recording, right? So they're farther along, right? So we have to start with that assumption. You know, someone who is open to treatment therapy is, a different segment of the group we're talking about here. But once someone's in cognitive behavioral therapy, what we're focusing on are a number of different things. We're focusing on primarily the beliefs people have about the possessions that they have, the beliefs that they have about their emotional responses to the possessions they have, and helping them kind of shift, how they think about possessions in a way in order to lessen their anxiety, lessen their feelings of loss, so that they're better able to let go of items. We also focus on more practical skills having to do with organizing possessions. Something like a quarter of individuals with hoarding disorder have a co-occurring diagnosis of ADHD, but frankly, a far larger portion, I would estimate, who have hoarding disorder don't meet criteria for ADHD, but they have weaknesses that are similar to the weaknesses people have with ADHD. The ability to plan, to organize, to actually start a task, sustain a task, right? Many people with hoarding disorder who don't have a diagnosis of ADHD have those weaknesses, right? And so we teach skills in cognitive behavioral therapy to address those things. How to organize your possessions, how to categorize your possession, how to plan for your possession, how to start a task, how to manage distractibility. There's all kinds of skills like that as well. And then last, we really focus on kind of limiting acquiring, and also and doing more letting go practice, so that the person learns that they can actually tolerate the feelings that come up around letting go and also resisting acquiring, right? And that's what the package looks like.
It is something that sounds like it's going to take more than one session, that it is an ongoing process. So with that in mind, for someone who's got a loved one that has unsafe level of accumulation, that wants to deal with the first part through a resource like ours, and then wants to really help for the long term through cognitive behavioral therapy, what does success look like? Help frame the expectation for reasonable improvements. Is it something that is a month? Is it a year? Is it multiple years? And I know it varies by person, but what are the parameters that people should be thinking about when it comes to manifesting gradual and permanent improvement?
Yeah. The randomized controlled trials on cognitive behavioral therapy for hoarding disorder suggest a much longer course of treatment than cognitive behavioral therapy for other problems, right? And so that could be, as many as 22 or more sessions over the course of a year, probably a bit more, right? The other thing, piece of the treatment that is very indicative of how well someone responds are two factors. One is the the frequency of home visits, right? In order to actually help a person kind of like generalize the skills that they learn in the therapy to actually, managing clutter in their home, it requires home visits. And so what we know is the more home visits a person has as part of that treatment course, the better they're likely to do. And then the second factor is when we set up homework, practice in between therapy sessions, how adherent is the person in following through with that homework. If they actually do the homework and do it pretty consistently, we don't expect 100%, but if they do it pretty consistently, the chance of them improving is better. Now, what is improvement? Well, I will tell you what is not improvement. Is someone with hoarding disorder can do extremely well by our measures, in terms of like a 50% reduction in some measure of clutter, for example, and their living environment will look more cluttered than mine or yours, right? But what will change is their ability to function effectively in that environment, right? Because it's less cluttered, right? And that's what we're really looking at. And then once we achieve that, trying to help the person apply those skills to maintain their functioning in this less cluttered environment.
The interesting thing is about the conversation, whether it's on the emotional drivers of the behavior or dealing with the environment, is that you very often, and we see it in our business, you have to turn to a third party for help. What's your belief around the importance of third parties as a way to neutralize the family dynamic that may have built up to a point of frustration over time? Is it important?
This is hugely important, Dan. And the reason is motivation to change, motivation to accept help is influenced by the quality of the interpersonal relationship the person has, right? So if your relationship with your loved one is distressed, then they're going to be less likely to accept help, right? But if you change, and if you bring someone else in who doesn't have that history of a distressed relationship, the person may be your loved one may be more motivated to actually accept help. And really, that at the end of the day, that's what we want. We want this person who's suffering to accept help.
Dr. Tompkins, what's different about the disorder from other OCD-related issues that may keep them from seeking help?
Yes, people with hoarding disorder appear to have much reduced insight relative to people with OCD. But there can be lots of reasons, and we actually don't know for certain what those reasons are, but here are some suggested reasons to explain why so many individuals with hoarding disorder refuse help. One is they're overwhelmed, right? They are completely overwhelmed. When you go in to actually have a conversation with them about decluttering and clearing their environment, and you look around, it's an overwhelming task. And so their no is in response to, no, that's overwhelming. I don't want to do it. I can't imagine doing it, right? Secondly, they refuse help because they're afraid of being discovered. This situation being discovered, because once a situation like this is discovered, things can start to happen over which the person and the family have little or no control over. It just is a rollaway train, right? So they're afraid of having it discovered.
I want to end on a look both at, and you've done a wonderful job today for us of giving us concrete examples of where we are in treatment of hoarding disorder today, and through the repetitive and ongoing experiences of CBT. Jump forward 5 years, 10 years from now, what do you hope, what do you see coming down the line that may make the process of addressing hoarding disorder even easier? What kinds of developments are we looking at? Are we looking at medications to support it? Or are we looking at tweaks to the existing regimen of CBT?
I think that the things that I view as the most important are one, to continue to educate the population about what hoarding disorder is and what it's not, in the service of decreasing stigmatization. In a hoarding disorder, people who suffer with hoarding disorder are highly stigmatized in our culture. They're viewed as lazy or dirty or any number of other very punitive labels, right? And it's often not seen as a mental health issue, which it is, right? And so more education to actually destigmatize, and so for people to learn, this is what this is about. The family members to learn that, but also so that the destigmatization also in the service of people being more willing who suffer with the problem to accept help. That's one thing, and that's really important. So this show and the shows like it are so critical in that regard. The second piece of this is that more mental health clinicians choose to be trained in treating this problem. Because I will tell you, even if you're a problem, someone with this problem who is open to help, finding someone who's qualified to help you with it is not an easy task, right? So more training of professionals, more encouragement of professionals to actually learn more about this problem and how to treat it effectively would be great. And then the third piece that's related to this is to insurance companies. This is a problem that actually cannot be treated effectively solely by therapist and client in the office. This means that the therapist needs to go into the person's home to provide treatment there in order to generalize the benefits. Insurance companies need to pay for therapists to go into people's homes for that service. And insurance companies, my experiences, are reluctant to do that. Right?
That is a fascinating place to end on, and that could be a show unto itself. And I'm sure the math would be quite straightforward, that the cost of a fall and a 30-day stay in rehab dealing with a broken ankle from clutter at home would be far more than sending the therapist into the home to help deal with the underlying issues for hoarding disorder.
Absolutely.
Dr. Michael Tompkins, what a great conversation today. Thank you so much for sharing your expertise and for helping to make all of us a little bit smarter about both hoarding disorder and, as we talked about at the outset, age-related hoarding behaviors. I'm Dan Lagani. Thank you for joining us today on AgeWise. We hope we delivered on our promise to make you a little smarter about everything that you'll need to understand as you and your loved ones grow older. If you like today's episode, please share it with a friend. And if you want to follow every episode of AgeWise as they come out, just go onto your Apple podcast platform and subscribe, and you'll be part of it.